Hi everybody, Elisa DiChristina, licensed clinical social worker and author of Are You a Glow Kid? Psychosocial Emotional Educational Program for Optimal Childhood Development. So this video is to qualify me as an author of the program. So I wanted to share with my audience a little bit of background and what qualifies me to speak on the topic. So I'm going to go back all the way to 1996 and 97 when I was an intern at a children's residential center out of Hackensack, New Jersey. I was assigned a little boy about 8 years old and worked with him out of the residential center. And I'm going to go to 1997 to 2003. I was a high school substitute teacher in the Bergen County Vocational Technical School System. So that was nice to have an experience with children a little younger and then the teen population in an educational setting. During that time, I pursued a master's degree at Keene University and graduated with honors in 2002. During my internship, when I was at Keene University, my MSW internship involved, I had 2 internships, and one was at Irvington General Hospital, which is no longer in existence. So I was there from 2001 to 2002, and I performed psychosocial assessments in the emergency room and inpatient floors, and helped with typical duties of a social worker, discharge planning, and I got a nice variety of social work duties because it was a small community hospital, and I was able to work from the emergency room to different inpatient floors all the way to the ICU, where I spent a lot of time and learning about end-of-life care, advanced directives. I participated in some bioethics committee meetings. It was a very nice internship. Learned a lot about bereavement counseling and family mediation. And my other internship was through Children's Aid and Family Services, and my primary location in 2000 to 2001 was Woodley Group Home. It's a female adolescent group home for children that were not placed with a foster family, and I did a lot of work with female adolescents to strengthen their independent living skills. So that was 2 different experiences. Again, I kind of gravitate towards working with the children and the teen population. I also completed a clinical internship for Family Intervention Services, which is based out of Morristown. They had a summer program for teens that were co-ed, so male and female teens who were trying to avoid going into the juvenile detention system. So we provided a lot of group therapy interventions and outdoor adventures to foster different life skills and teamwork and team building. So that was a really neat experience with the teenage population once again. I then, in 2004 and 2005, became a certified instructor for the New Jersey Division of Human Services. I taught it was called the Career Ladders Program to New Jersey Human Service, and we taught to New Jersey Human Service workers, and at the time it was under DIFAS, now known as Child Protection Services. So I taught a Career Ladders program to child protection workers. So that was very nice to be employed as a professor simultaneously at Passaic County Community College teaching intro to psychology courses for college students. in Patterson. They were both right in Patterson. And I also took a position in 2005 as an HIV case manager at UMDNJ, United Medical and Dentistry of New Jersey at the University Hospital. So I did outpatient social work for HIV case management. So that was all around 2005. Now, during 2003 to 2005, I started gravitating towards the mental health social work specialty. Social work is such a vast career that you could work with many different systems, populations, ages, but I started to gravitate more towards mental health and social work. So I passed my certification and became certified in as a screener. So what a psychiatric emergency screener does is sometimes after we do a mental health assessment in the emergency room, typically, although we do go out in the community, to see high-risk patients that are at danger of maybe harming themselves, others, or property. So we do the face-to-face assessment to see what the treatment plan would be. A lot of times a screener is seeing if, in fact, a patient needs to be signed in we would sign a patient in for them because maybe they were limited in their cognitive function and were not able to see that they needed hospitalization to be stabilized. So as a screener, we go in first, make that decision. If that decision has to be made for a higher level of care, then we give our reports to the psychiatrist. The psychiatrist comes in within 24 hours and fills out something called a PC, which is a physician's certification. From there, the screening document and the physician certification have to then go to court for a judge to approve signing in someone against their will to stabilize them. So I performed the role of a psychiatric emergency screener in Newark, at Newark Beth Israel Hospital, and in Newton Memorial Hospital at the time. And I was a psychiatric emergency clinician at what was Chilton at the time. So I got a very different perspective of the urban, rural, suburban mental health presentation. And mental health does not discriminate. It is in all shapes and forms. So that was a great experience, and I did that for many years. I also worked in 2005 and 2007 as a psychotherapist for Partnership for Social Services out of Franklin, New Jersey, and was a psychotherapist for those years, 2005 to 2007. So my caseload involved seeing children individually, children, teens, adults, and couples. And at the same time, I led a support group for divorced parents. So, and I helped a lot with New Jersey accreditation standards, and I would write reports for judges. Sometimes people were mandated into psychotherapy treatment, so I would write reports to sometimes child protection, sometimes the judge, sometimes both. So that was a tremendous experience. I decided to go back and get I decided to apply to be a divorce mediation private practice court-approved parent coordinator, so that couples that were having a hard time in their divorce would often seek out a parent coordinator to help make arrangements with child custody schedules, visitation, things like that. We would try to resolve it without and avoid going to court. So I would assist a lot of couples doing that as a New Jersey approved parent coordinator. So that was another credential along the way. I would also I also went back to Rutgers to receive my mediation certification. So I was a New Jersey approved mediator and helped write memorandum of understandings, which is something that can help be submitted to a lawyer to convert into a property settlement agreement. So we would try to save cost and work with families that were divorcing face to face to save a lot of funding and help the children not suffer so much trauma during the divorce, and help financially. It expedites the divorce process, or tries to. So that was interesting. I had a private practice as a divorce mediator in the state of New Jersey for a few years during that time. And while I was at Newton Hospital in 2007, I also rotated on some of the floors. So simultaneously, when I was at a lot of the hospitals, I would also offer to do per diem hours on the inpatient floors. So I would work as a psychiatric emergency screener in the emergency room, but also provide inpatient social work assistance. So during my time at Newark Beth Israel, I also would work on the CCIS unit, on the children's inpatient unit, as a social worker, and engage in group therapy and individual therapy, and meet with the parents and work on treatment stabilization for a child that needed the level of care of inpatient care. While I was at Newton, I worked inpatient on the adult unit, which was voluntary for a voluntary adult and an involuntary adult that had to be signed in. So that was nice to have the inpatient and the emergency room experience. I also worked at Chilton and the Collins Pavilion. The Collins Pavilion was to provide cancer treatment, and I ran a support group for cancer patients as well. So from there, I decided that I wanted to own my own company, and I opened up Glow House Kids in 2011. And Glow House Kids work is not about the treatment and the diagnosis. It is about the prevention and the important opportunities that children need to flourish developmentally. So Glow House Kids is located now in Pompton Lakes, New Jersey, and it's a 1,600 square foot glow-in-the-dark facility, maybe a little bit bigger. I think it's 1,800 square feet. We've been in business for 8 years. I'm the CEO of that company, and the co-founder is my husband. We do have 2 children. Glow House Kids provides a lot of birthday parties at glow-in-the-dark, programming, safety classes. I also write newsletters and articles as a mental health content contributor to Garden State Safe Kids, and have contributed to other newsletters. I was featured in the New Jersey magazine in New Jersey, and a few national conferences such as the PAL conference. And Glow House Kids has been providing primarily 5 main services. So the birthday parties, programming, scouts, fundraising, and field trips. And we focus a lot as well on providing programming for special needs. So we run a group every week for one of the special needs schools, where we work with children that are on the spectrum. They might have autism or other diagnoses, and we help the children with their life skills. And I think that's a good cue to stop. Thank you for watching, and we hope you enjoyed this qualifying video.